Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam, a cardiologist. In this presentation, we are going to look at what are the options available for patients who are allergic to statins and who definitely need statins. I'm talking about patients who have multiple risk factors, patients who have history of coronary artery disease, who have coronary stents or bypass surgery, who do need to get their LDL levels below 80 milligram percent, and if they are allergic to statins or if they cannot tolerate statins, what are the options available? And in this presentation, we are going to cover all the different options that are available, how they are administered, how frequently the patients have to take them, and what is the cost involved, so that you have a better knowledge of what to expect when you talk to your primary doctor or a cardiologist or a lipid specialist when you're dealing with complex issues related to hyperlipidemia. So let's begin with the feature presentation. And here is a chart showing all the different options that are available for managing patients with hyperlipidemia, especially high LDL levels above 100 to 140 milligram percent, in whom you would like to bring the levels below 80 milligram percent and also reduce the total cholesterol level. So here are the three main categories of drugs that are available. You can follow my arrow here. The first one is PCSK9 inhibitors. There are two different drugs available, namely Repatha and Prolent, and we'll discuss the dosages and the cost. The second is the Bempedoic acid, which is a standalone drug available in the United States, which is given as a pill. Then, of course, we have the good old standard bile acid sequestrants, which remove bile in the GI tract while they are traveling. And finally, we have the ezetimibe, which is useful for reducing not only the triglyceride levels, but also in terms of potentiating the effects of other lipid-lowering drugs, plus lowering the LDL levels. Okay, let's look at all these different drugs. Repatha is one of the latest kits on the block in terms of managing hyperlipidemia. It has a significant reduction in the LDL levels by almost 30, 40, 50%. The big disadvantage is that it has to be taken as a shot every 2 weeks. The monthly cost of this drug is approximately $600. So you're talking about $7,000 to $8,000. Unless you have an insurance coverage, it could be pretty staggering, especially for Medicare patients who are dependent on Social Security to maintain their life. The next pill is, of course, another new drug on the block, which is the Bempedoic acid. It is administered as 180 over 10 milligram, a combination drug, which costs approximately almost $5,000 a year for dosage. Unless you have a prescription plan, it could be pretty steep when it comes to using this drug for lowering the cholesterol level. Then we have the cholesterol, which has been around for decades, which has been useful in patients who are allergic to statins. At the same time, cholesterol and bile acid sequestrants cause a lot of GI symptoms, which make people shy away from these drugs. Anyway, these drugs have to be taken 3 to 4 times a day. Some of them come as pills, some of them come as powders, which you have to dissolve in like orange juice or apple juice and take them. It is 4 grams 3 to 4 times a day, cholesterol. And here's the cost is less than $100 for the powder. Some of the tablets, the generic ones, can be as low as $20 per month. Finally, we have the ezetimibe, which is 10 milligrams given once daily, either as a single dose drug, or it can be given in combination with statins and other drugs. It seems to lower the cholesterol level by 10 to 15%. So compared to PCSK9 inhibitors, which can reduce the LDL levels by 50%. The reduction by ezetimibe is modest, but when it's combined with other drugs, it does have a significant effect. The cost is about $15 per month if you go with the generic pill. So ladies and gentlemen, this is a quick review of So, ladies and gentlemen, just a quick review of drugs that are available to treat patients who are allergic to statins but definitely need medications to lower their total cholesterol level and the LDL levels. I hope this has been educational and useful to you. Thank you so much for watching. We have hundreds of videos on patient education with reference to heart and heart disease. You can watch them, and I will see you in the next presentation. Bye.